élaborer des stratégies qui puissent nous permettre de répondre aux besoins sanitaires et s'appuyer sur les infrastructures
and take
sanitaires.
up challenges, health issues, challenges related to health, improving technology, improving the workforce, the human resource we have on the continent, and we need to work about the death fatality rate so as to really decrease that rate. I would like to talk towards our partners, bilateral donors or multilateral donors. All these donors need to align on our priorities. These partners need to provide support, and we need to mobilize, galvanize all these at national level. This appear evident. We need to also bring in our own funding, put our in our pocket, I mean, on our own funding. Private sector need to play a key uh, role. Health policies and strategies at the national level, we need to provide detailed understanding. We know, we are conscious of that. We need to invest and enable us to have funding so as to take up challenges and address these issues. The strategies we have should enable our member states to come up with training, try to tailor our workforce. We need to plan over several years and implement the plans, strategies we have. In this quest, I think it is a multi-faceted strategy. We need to include and involve our communities. Communities represent strong resource. This community need to be autonomous, self-reliant. They are the driver of growth at national level, regional and continental levels. Without these communities, we are losing many partners, key partners that we need to galvanize, we need to mobilize so that they will provide their contributions. If we have communities on our side, partners and leaders involved in all our plans and projects in the health sector, this will not remain as a rhetoric, but we will go into the practice on the field. Health workers constitute the cornerstone of this initiative. Empowering them, building their capacities will be very key so as they can provide the well health care and reducing this burden of the fatality rate. So this will help to reduce inequalities in terms of health, providing quality services, which will enable us to improve our global outcomes in terms of health result. Ladies and gentlemen, the investment in health workforce is very key, is very important. This will also create possibilities of decent work, decent employment, mostly for women. Women are the majority of the population group in Africa. They are the source drivers of our economy, and we will see the productivity will also increase when the workforce is healthy. This health workforce will help in transforming the dividend. African continent is a young continent filled with young people, and we will see the dividend need to be harnessed. This dividend is, when this dividend is healthy, is also well equipped, we will see increase in the living conditions. It is therefore the head of states and government also adopted the initiative of 2 million new job. This was promoted by many before us and is calling upon recruitment, training, deployment 2 million health workers over the continent of Africa, so as to take up the challenge of capacity in terms of human resource for health, quality human resource for health. This initiative is very key. It's enabling us to increase the health workforce and not put it in mind the call that was launched in 2019 could intensify and the community health workers as well. To conclude, ladies and gentlemen, I would like to launch this call for investment into the health workforce. We will reach universal health coverage and we improve the health outcomes, especially among our communities for healthcare. This means we will also meet our objective of universal healthcare in Africa. Thank you very much, Madam the Moderator. The floor is yours. Thank you very much for the opportunity given to us in this platform. Thank you. Thank you very much.
I think coverage of some of the key issues about investing in the workforce, and I'm very appreciative of your covering partnerships, which was going to be a key piece of what I was hoping you would discuss is the power of partnership to mobilize and the critical role of the health workforce for our pandemic preparedness, for the strength of our public health institutions. And so I thank you very, very much for your comment. I would like now to actually turn to the Honorable Minister from Ethiopia to share a little bit about the extraordinary investments and progress that you've been able to mobilize with partners for the health workforce in your country. And if you could, I think many people sort of want to see these examples, and it would be terrific if you could share with us the ways in which Ethiopia has been able to leverage partners to create progress and where there may be additional needs.
Thank you very much, Dr. Vanessa and Deputy Madam Chairperson and all excellencies or protocols observed. Thank you for the opportunity to share some of the experiences on investing in health and care workforce of Ethiopia. I think we have all seen investing in health care workers is a critical pillar of our health system, particularly what we have seen in the last few years within the pandemic. And of course, the last few decades, Ethiopia has been one of the areas of government commitment has been investing in the health workforce. And of course, the first one starts, of course, with training the different cadre of professionals we need for the health system, starting from our community health workers, which we call health extension workers, up to the different diverse specialties that we need. So the first one, of course, seeing the critical need of accessing primary health care for the vast challenges we had. So around 17, 18 years ago, the community health program was established, and that's when training of these health extension workers started with of course, with an evolving kind of curriculum every time, because we have been reviewing the need of the community and the need based on the services that they have been providing. So the package of training was evolving through time, but this training and commitment, and progressively we're working on expanding the residency programs, particularly in different key specialty areas like OBGYN, surgery, and others, which are critical for addressing the health needs we have. But also in terms of public health emergency, we've been also expanding training programs like epidemiology and lab training programs, emergency medical technicians in the recent years, which had actually, for example, the field epidemiology was started for the Ebola preparedness, but it was key supporting the health system when we had the COVID outbreak. So this, and also there were some task shifting training that we had established. For example, one of the key challenges we had is a high maternal mortality, which could not be addressed by the very few doctors and OBGYNs we are training. So at some point it was decided to train surgical officers for 3 years as a graduate program for those health officers. So they have been serving in primary hospitals. We have trained around 800 of them and serving in different primary hospitals. But of course, as I said, we have to evaluate and make other course corrections or change on how do we continue to those task shifting. Since we have now a large number of doctors being trained, that large number of surgical officer training has minimized, but we are continuing to do that. So training, expansion of training is a key aspect on the pre-service aspect, but also the quality. So the key aspect of working with Ministry of Education in terms of competency-based curriculums and expanding of simulation labs, but also beyond the training, introducing licensing exams, standard exams, and mandatory continuous professional development trainings for those who are already on the job has been crucial. And of course, we've had a lot of in-service training programs, but they were not required to practice or to be relicensed. So now we are moving to that direction because this is critical to maintain quality. This helps motivate the workforce, but also ensures quality of care. So beyond that, one other critical pillar we have been in training is a leadership training of leaders within the health workforce, which has been a big gap, also challenge. So there are different, I may not want to go into the details, but trainings like formal ones like Masters in Healthcare Administration for hospital leaders, but also recent training programs we are doing on leadership incubation programs to bring up emerging leaders into the health system is one of the focus areas, because that's one of the gaps we have seen in the health system. But within all this, gender lens has been one of the critical issues, which is both in terms of ensuring that enough number of female trainees enter into the medical schools or other training programs and enter into the workforce. And now we are also looking into how do we really enhance them entering into the leadership, because now the large number of health workforce actually are women, but when you look at the leadership aspect, there are very few. So looking into those aspects is one of the areas we've been looking at. But also, it's not just training and not just ensuring the competence and quality, but also ensuring motivation is key. So really creating what are the conducive environment we can create and ensuring protection and safety during problems like the pandemic. But this is an area which is very challenging, particularly in countries like ours, because we know we have low pay and many other factors, although we are trying to introduce different mechanisms to push this agenda, but this requires collective support. So, but all this I have spoken, there's a critical pillar of partnership. How we have achieved what we achieved so far, we still have so many gaps, but for what was achieved so far, partnership at different levels has been really crucial. And to highlight few, particularly for our training programs, collaborations between academic institutions, both north to south collaborations and south to south collaborations have been key. I think it has been more towards the north to south collaboration, and I think especially as African Union, we have to really look at what are the opportunities for south to south collaborations to expand. We have some of them, but not enough, which we can really leverage. And also, of course, the different partnerships with donors, implementing partners in the private sector, and what that we've had to expand all the key areas. And I think especially within the pandemic, we have seen very strong collaborations like with Africa CDC, WHO, and others to train our workforce to really be able to prepare to respond to those emergencies. But I think this should be institutionalized so that we have our workforce ready for different pandemics, and we don't have to run to train them once we are in the pandemic. So I think these are a few things I would like to share. Thank you so much.
Thank you so much for those comments and for the extraordinary journey of investing in the workforce that the country has been on. I appreciate to be able to hear some of that. And I appreciate also the highlight of the fact that many women are in the workforce. And as we know, about 70 to 75% of the workforce is women, and yet only 25% of the positions of leadership are occupied by women in health. And further, there's up to 3 trillion of unpaid work being performed by women in the health systems. And when we think about that, the role of women and how we are going beyond, I feel like I've been hearing these statistics for a while now. The question is, what is the action point? And we are here for action. We're here to motivate partnerships to change and to create the progress that we seek. And with that, I'd like to ask Professor Roballo kindly to speak about what are the partnerships that we need to create? What is the role of partnership to galvanize action to actually transform the agency and recognition and role of women in the workforce formally?
Thank you very much, moderator, Dr. Vanessa Carey. I would like to acknowledge the leadership in the room, the Deputy Chairperson of the African Union Commission, honorable commissioners, honorable ministers, invited guests. There's a pillar. There's no partnership if we have pillars in between. Women in Global Health and myself are very grateful to the African CDC and the African Union for the invitation to participate in this very important conversation. I think I have 3 points to make around partnerships. I think, first of all, it is really to be acknowledged this important step forward that the Africa CDC and the African Union are taking in terms of reimagining the development of the health workforce for the continent. It takes several crises for us to then get energized, but at least we are getting energized. I'm saying this because this is not the first crisis we have. It's not the first initiative. I'm not saying from the African Union, but if you think about the crisis by HIV/AIDS and all the initiatives around task shifting, role shifting, etc., it was trying to address the shortage of healthcare workers, but it didn't go far. We are still talking about task shifting, role shifting, surgeons trained in short programs of 3 years. We're trying to put short-term solution to a long-term problem. And I think, and I hope this time we will take off. So that's important for partnerships, I think. We really need to embark on this with the level of ambition that will make it sustainable and will carry the vision forward. If we don't start with that, it's going to be a short partnership. In 5 years' time, we'll still have the same problems, and then there will be another pandemic. We'll be running after the health workers that we didn't train, we didn't build before. That's the first point I wanted to make. The second point